Hello, ladies. Last one for the day. This is our second webinar in our webinar series, and it is titled, How Much Do I Charge My Clients Living with Cancer for any salon or spa services that they have with us? So I hope you're all ready for the notes. We've already recorded 3 today. We'll pick the best one out of the group, and we will upload it onto YouTube within the hour. And so it will be available for you to listen to again and again and again, just like the others. Okay, so when we have people that are diagnosed with cancer, sometimes we have this compelling desire to not charge people because we care so much about people. And so it becomes a debate in our minds as to whether we charge somebody, we know they're struggling physically, emotionally, mentally, and even possibly financially. Or do we offer them a free service? You know, we also have businesses, we also have bills to pay. So this dilemma plays with us a lot, and we need to really look at it from an objective perspective so that we can survive, but also support people with cancer at the same time. So let's just go through a couple of notes here about an average cost of a facial, with the national average being about $80. You can work from a minimum to a maximum, maximum of like $250. So let's just stick with that average range of $65 to $90, and how we break it down to actually get a cost that we charge. Once we've got a cost that we can charge for the service, then we need to look at how we connect this to people that have a modified treatment. So the common approach to pricing typically is, you know, you might go to a spa in your town just because you want to do some investigation about what sort of pricing is charged for facials. So you go to some spa or salon in your local city or your local town, and then you actually look at what you've just paid for a facial, but you also need to look at your town or your city's economic climate. Right now, with this coronavirus causing havoc globally, a lot of the salons and spas are having to shut down, and we don't know how long we're going to be shut down for. So it could be until the end of next month, which means a lot of us don't have much money coming in, and our actual clients and cancer survivors don't have money coming in either. So I imagine what's going to happen, and I really don't hope this happens, but I mean, I think that a lot of countries are going to start to scream about a recession. So based on recession, what is it that people can actually afford to pay? So that's where we have to look at the economic climate. And, you know, are you a luxury service, or do you offer luxury and necessary services? So we have to also look at that as well, because some people that don't like body hair make that a necessity. Some people that have skin related issues on their face, like acne, that becomes a necessity. But it also is actually a necessity for somebody who is undergoing cancer treatment, and they need to have some issues with their skin resolved. So maybe there's a symptom relief, maybe there's the appearance recovery, and maybe there is also that aspect of relaxation. And we discussed this in yesterday's webinar. So we always look at the intent of what the person's coming for and whether we can fulfill their intent. So a lot of them are not coming to us just because it's a luxury, but because they have an intent to get a service to sort something out that they have. The other thing that is also often done is just searching through the internet for any of the competitors' pricing for similar type services. And to be honest with you, you want to stand out. I mean, yes, it's a good idea to know what your competitors' services are, what they charge them, but you also want to have a point of difference. And also providing services to people with cancer and other health challenge is something different, because a lot of people are not doing that. Now, when you try to break down any kind of costs associated with a facial and or a body treatment, because these are two treatments that use a lot of product. You know, when you compare it to something like doing a service with reflexology, you're cleansing the feet, you might use a bit of powder, but you use some moisturizer and that's it. When we come to a cleanser or a body treatment, particularly a facial or body treatment, you've got a cleanser, an exfoliator, a massage medium, a serum, a cream, you know, whatever all that you're using on there. So you've got to look at the cost, the wholesale cost that you're buying the product from. You look at the size of it, and then you determine how many treatments you can do based on how much you use for each facial. Now, what's important is you take the cost, and the next slide will have the breakdown on how you break down the cost, you know, for each facial with the product. But you also need to add to that your cost to do the treatment. So in other words, your time, or it also could be that you hire somebody or somebody gets a commission. You also need to take into account the fixed expenses for the actual treatment itself, not your fixed expenses like your rent and your taxes and your phone and all that kind of stuff. I'm talking about fixed expenses for the actual facial, like your cotton pads or gauze or gloves and things like that. So now you've got your product, you've got your fixed expenses, you've got your time, and this starts to establish a cost per service. And this will also help determine your pricing, because you have to make sure that you have sufficient money in there also to cover your other overheads like your rent and your taxes and bank charges and uniforms and education and stuff like that. So this little chart actually is very brief and it's fairly simplistic. This is a cleanser, that's a 50 ml cleanser that you buy wholesale. The unit use is, it uses a pump where you get 1 ml of product out of there, and the cost is actually $25. That's our wholesale cost. Then you work out, you know, how many units you can get out of that and the cost per unit, and you're going to use 2, that'll leave you with $1. So I know I'm going through that fairly quickly, but there are very simplistic ways to actually figure that out. But here's what makes it a little bit more complex, is how many times you have to modify a regular service, the length of time that you're doing it. So let's say you've got somebody coming to have a facial with you today that is undergoing targeted therapy drugs. So targeted therapy is, unlike chemotherapy, it's still systemic, but it is very targeted. So the targeted therapies, there's the epidermal growth factor receptor inhibitor drugs, and we've got little epidermal growth factor receptors on our cell membrane. This drug targets that little receptor and switches it off. And so our skin cells start to get affected by this drug. And what happens is people develop this rash, and it's called a papulopustular rash. And it is found on the body basically from with the nipple line up, so the décolleté, the neck, all the way over the face, down the back, in line with the nipple. And it used to be called an acneiform rash, so it looks like acne, but it doesn't have comedones. It only has papules and pustules. So somebody might come to you and want to have a facial to get rid of the pustules and any of the inflammation on their skin, because it's red and it can be raised and it can be sensitive. So your regular length facial that you're going to do has to be shortened, or you have to eliminate some of the steps. You might not be able to do exfoliation, for example, like a scrub or even a peel. You might just do a basic cleanse, and you might just straight away go into actually doing extraction. But please be very careful with this one, because you need to make sure that the person is not immune suppressed. Sometimes chemotherapy is admitted with the targeted therapy drugs together. So as long as the person is at no risk for infection, you can do the extractions on this. But you may have to cut out some of the steps of your facial. So therefore, you're cutting out some of the product that you've already accounted into the facial. All right. So a friend of mine who's also a graduate of our program, she's a pharmacist, an anesthetician, a breast cancer survivor. She said to me the one day, you know, Morag, technically, if you really think about it, we're spending so much time and extra care with the cancer survivor. We're doing detailed intake forms. We're focusing on cutting back the services to make sure that it's safe for them. We're modifying everything. We're educating ourselves on that. We should technically be charging more for the services. But when people think about it, they get offended because they think, well, oh, shame, poor, it's a cancer survivor. They're already going through, they're going through so much. How can you charge them extra? But in reality, we really are paying a lot of attention to make sure that this person actually benefits from our treatment and we don't cause any harm for them. So I want to just put that out there. We are going to keep the pricing at the same, but there is a thought process because we spend so much time focusing on this issue that it should be more. The other thing when it comes to charging the client, we need to keep emotions in check. Having pity for a person because they have a disease or a diagnosis of a disease or because they're terminally ill doesn't do us any justice at all. People don't want pity from us. So be careful with how you approach pity and sympathy. Certainly empathy is a lot better, and empathy with mindfulness is even better. So you've got to be empathetic to their situation, also be very mindful of them in that moment, and we've already addressed the mindfulness there. So keep your emotions in check. It's very hard also not to cry sometimes when you know that you've had a relationship with a client for so long and then they tell you that they have been diagnosed with cancer and they've got X amount of time left. This does affect you, so look after yourself at the same time. Now, we mustn't make assumptions that the client can not pay for their service. Sometimes people book online. You don't know whose credit card is being used. It could be the wife's, it could be the husband, the daughters, the aunts, the grandmother. Somebody's paying for it. And if it's an online service where people are putting credit cards in and stuff like that, don't worry about where it's coming from. If they're coming into your spa and they pay just before they leave after the service, you know what? They booked in, they expect to pay, let them pay. Sometimes people are and can be insulted if you suddenly apply the pity factor and, oh, shame, you know what, you're going for cancer treatment, you probably can't afford it, so don't worry about it. Don't do that to them. They expect to pay, so don't insult them or humiliate them, okay? Just a reminder, though, for all of us to remember, we all want to be treated equally. So whether we have diabetes, lupus, whether we're hearing impaired, whether we have a prosthetic leg, we have a prosthetic nose, we all want to be treated the same and with respect. So if you're going to charge somebody that has diabetes the full price for a treatment, you're going to charge somebody with lupus the full charge for a treatment, why are you charging the cancer survivor with the discounted amount? It doesn't make sense to me. Let's treat all the people the same. Everybody pays the same. It is your time, you're in business, you treat everybody the same. Here is a situation that you can think about because this can occur. So if you need to shorten an allotted service, how do you charge for it? One thing for sure, I will tell you that sometimes a person, if they're undergoing cancer treatment, it could be any of the treatment. It could be surgery, chemo, radiation, targeted therapies, biological therapies, hormone therapies, whatever. Sometimes the drugs make people feel really awful. And while they have the intent to come in and have a spa or a salon service with you, they physically cannot make it or emotionally cannot make it, and so they cancel. So be kind when it comes to cancellations. If somebody does it on a regular basis or you know that they're actually just being lazy about it, then they get charged for it. But if it is a real situation where perhaps they are feeling really awful, or the doctor has called them and said, no, you need to come in, and so they're gonna, just scramble. The other thing is people also can go through chemo brain, and chemo brain is a very real side effect from chemo where they are extremely forgetful. So you also have to send reminders to them or send reminders to the caregiver. Otherwise, you're sitting there waiting and nobody's going to turn up. And so You know, how do you charge for that? Anyway, if you have to shorten a treatment, and I'm going to give you an example of somebody that would be undergoing chemo and they would like a reflexology treatment and they would like a pedicure. And the intent for reflexology is they experience a bit of nausea because nausea can be balanced out with reflexology. They just want some balancing out and relaxation. And the pedicure is because the skin's dry on the feet. Of course, chemo affects the skin, so the skin and the nails are dry, and they just want their nails painted. So now you sort of 40 minutes into the reflexology session, and the client says to you, oh my gosh, I'm starting to feel really nauseous. So what do? First thing you're going to address is obviously the nausea. And there are a number of things you can do with that. You can offer them ginger tea. You can put like a spearmint, peppermint, ginger essential oil into a diffuser. But please make sure that if you're working with aromatherapy, the client has to pick that particular essential oil. Okay, and there's a whole reason behind it. So give them a choice of 3, and they decide which essential oil to use to help them with the nausea. There's a pressure point on the inside of a person's wrist, 3 fingers up the arm. There's a little pressure point there for nausea. You can press that on them. You can go to their feet and you can press the solar plexus area and have them do some deep breathing. You can switch the lights off in the room or switch them down so that they're dark. And if there's music and loud music, switch the music off. It's got to be a very calm, serene environment. The other thing is you might also just want to be prepared with like a little emesis basin. An emesis basin is just a little basin they give in the hospitals for people to vomit in. It's have like a stainless steel bucket or bowl or something. And if somebody says they feel nauseous, just have it available in case. So your 40 minutes has been done of reflexology. Now you've got this person feeling like they're nauseous, and now you're running around taking care of the whole nausea thing, which will probably take you to the hour. Now the issue is the person doesn't want to have the pedicure because they're not feeling so great. So do you charge pro rata? Well, you can, but you've just covered a full hour with them, so they should be charged the full price there. It's a tricky one when it comes to now charging them if they want to go home after that and to charge them for the pedicure, because that is time that you've lost and you might not be able to fill that gap, okay? So technically, they should be charged for that. On the other hand, what I prefer to do is I know that I've allotted 2 hours to them. And so what I would suggest to her is, look, let's get your nausea sorted out. And I know you want your nails painted, and I know that your skin's dry. So let me do a mini pedicure on you. In other words, just cleanse the feet and moisturize them and then paint the nails. You still might have another half an hour to take you up to the 2 hours. So I go from touch to no touch, or I apply the practice of mindfulness, which again is paying attention to the present moment and focusing on the intent with them relaxing and not judging them for it. And so I never leave the room. I'm there with them for the 2 hours, so they get the benefit from my attention, the fact that I'm there, whether I'm touching or not touching. Some people are just willing to have you sit in the room and just like have your hands on their feet and not do anything, not even stroke your thumbnails or something on them. So it's all about being still and being mindful. So this way, if you can resolve a negative symptom issue that's arising, but keep them there for the full time, you're still getting paid for your services, and there's no need to feel bad about it, because truly you've given them a wonderful gift by just allowing them to be there. Now, many estheticians say to me, well, you know what, I'd love to be able to work in a hospital setting. I really encourage you to start building your clients in the spa, because talk to them. There's so many people with cancer out there. If you still feel the need to go into a hospital setting, you know, you need to be prepared to put together a nice proposal, because most hospitals have a not-for-profit group in there already called Look Good, Feel Better. And your proposal needs to differentiate you with Look Good, Feel Better and the differences between that organization and you. And I can tell you right now, some of the differences are that Look Good, Feel Better use products that are just supplied to them. They're not customized for the person and their skin-related issues at the time. So that already puts you in a much better bracket. Their education is in a group, and they're told how to apply makeup and skincare to their skin. You can do a one-on-one with them. You're touching them, you're listening to them, you're asking them questions. You can't do that with Look Good, Feel Better. So find all the reasons why. And I'm not saying Look Good, Feel Better is bad. I'm saying we can do better than Look Good, Feel Better. But you have to put it in a proposal to somebody at the healthcare facility. Who would that somebody be? Either the head of the oncology unit. Hopefully the hospital has an integrative medicine department or integrative oncology department, because integrative oncology embraces, you know, aesthetics, massage, nail care, nutrition, yoga, wigs, all that kind of stuff. With your proposal, you need to add clinical studies. We have one that was done specifically on our training, and we've got plenty others to support areola tattooing, massage therapy, body image issues, etc., aromatherapy, reflexology. There's a whole lot of studies out there. It's a matter of finding the right ones to put into your proposal. Something else that's really important too is endorsements from other healthcare professionals. Are there any doctors, nurses, chiropractors, naturopath doctors, homeopaths, herbal medicine doctors that come to you and have services with you that can endorse what you do? That's important, because healthcare professionals listen to healthcare professionals. Have you got any endorsements from cancer survivors? Cancer survivors are some of your biggest marketing supporters. I mean, the minute somebody says, you know, I go to my esthetician and they get my skin issues resolved, the doctor will listen. He may not do anything or act on it, but if he starts to hear this over and over again, eventually he might say, well, who is this person and what does she do? Also, when you're starting to address the healthcare system and people in the healthcare system, they run a hospital like a business. So the first thing they're going to ask for is, what is the benefit to their facility? And the benefit to their facility is that you're offering their patient a one-stop shop type of thing. In other words, they can go and have their treatment, or while they're having their treatment, like they can be having chemo, they can actually have a mini facial on that. Or they can finish their radiation, and then they can go to a room, if you're renting a room in the healthcare thing, and they can have a treatment with you. So you've got to include the benefit to the healthcare system. Or the healthcare facility, what is the benefit to the patient? That's the next thing they're going to want to look for. And you want to make it that the patient is going to find it easier to have all the additional necessary, you know, complementary and integrative services in the same facility. They don't have to worry about parking and walking for miles, and they're close to doctors if they need it, and they're close to the washroom. You need to put down what the benefit is to the patient, and the fact that they're going to relax, and it's going to help with some of their symptoms, and it's going to help them, you know, with their appearance, so they feel better about themselves. And then you have to worry about you, unfortunately. Okay. As far as the charging goes in the hospital setting, if you happen to have a proposal that's accepted, they may have space for you in the hospital, or they may be able to refer to you out into your location. And very often a 10% discount is applied off your regular services for the healthcare staff or employees plus their patients. If the hospital or healthcare facility has an integrative medicine department or an integrative oncology department, some of them expect the patients to pay cash. So any treatment that is offered is cash-based. Some hospitals have budgets, and so how the system works there is the physician or the oncologist will say to the patient, you can go and have a 30-minute facial with Morag. He has a prescription for that. You come to Morag, you have your 30 to 45-minute treatment, and Morag says, thank you so much, and, you know, off you go, and then I invoice the hospital to get paid. Then you get hospitals or healthcare facilities that don't have budgets. They love the concept of appearance recovery and skincare and that, but they don't see it as a necessity. And so they'll say, sorry, we don't have a budget. And so you got to be proactive with them and say, well, how can I help you raise money for this? Or can I, do some fundraiser that'll get donations in? Because some hospitals already work on fundraisers to get donations to cover oncology massage. So why not oncology aesthetics? So again, your story has to be convincing. In the US and Canada, we have tipping, which I don't agree with, but that's the way it is. And tip jars can be put onto the your front desk. And just be aware, tippings, typically in some places need to be declared for tax implications and that. But honestly, if it's a small gesture to help somebody out that doesn't have the money for it, why not? Explain to your regular client base who you're trying to raise money for and why. Make it a personal thing, because you don't want to have it misconstrued as, oh, well, you're just trying to get additional tip money. So here is a photograph of this live real person. This is their email address or their Facebook page. You know what? They're going through chemo right now. They're going through radiation, and they got these really, really bad what we call radiation burns. It's actually radiation dermatitis, but they need some product to help with that, and they just can't afford it because they're a single mother and they just lost their job or whatever it is. So make it personal. You might find that another client of yours who can afford it will be really happy to be able to make contact with that person and say, listen, I'm going to pay for you to have 2 products or to come in for a series of facials or whatever. So you know what? Giving forward is a wonderful way to do it. We have another model in Massachusetts, which was founded by Holly Brown, who's one of our graduates, and it's a not-for-profit. So if you're interested in wanting to create a not-for-profit that actually works, the model works, you can contact lookfeelfab.org and speak to Holly Brown. These are some of the programs they have and how they actually provide services. The wellness program, the cancer survivor can have 5 free services and 4 free full-size products. For the survivors now, that is for 3 free services and 30% off products. And then there's the pay it forward. So once they're in remission, it's now $50 per service with 20% off the products. So they have a wonderful concept there if you're interested in modeling or licensing their concept. Because we're tackling one sort of service focus with each of our webinars, here we're going to talk about breast cancer. And here in this particular case, the person had breast cancer on the left breast. So we're talking about how you modify your massage strokes. So the head and the neck are not affected because it's in that upper 5th quadrant. You can see where the clavicle area is, and that is the upper head and neck quadrant. It's not affected by the treatment. And so you can do a normal facial there, but direct your strokes down, following the lymph, and then finishing at the clavicle area. When you start to work on the décolleté, normally you are directing your strokes to the underarm or axillary area. Because that left side has been affected with surgery and lymph nodes, like a lymph node biopsy or dissection has occurred, the lymph system is affected there. So you need to redirect your strokes way over to the other underarm area or to the midline where your sternum is. And that's how you would modify your actual stroke direction. The same person may, because that upper left quadrant is at lifetime risk for lymphedema, you have to modify the arm as well. So if you're going to massage the hand and the arm, your strokes, which are your effleurage strokes, start with the fingers, they move up the lower arm, get to the elbow area, and then you switch around to the back of the upper arm, and you direct your strokes up to the axillary on the back of the person. Why are we talking about redirecting strokes? Because a person that has a lymph node biopsy, which is typically wherever your tumor is, a solid tumor, the surgeons will go to the closest 2-3 nodes, first, well, 1-2-3 nodes closest to the tumor and remove them. What they'll do is they will test them for cancer cells. If there are cancer cells in these 1, 2, or 3 nodes, they'll go back in and do a second surgery and remove 20 or 30 or however many they take out. And so we know that removing lymph nodes from an area like the axillary area or the neck area or the groin area, those are your large watersheds. That's where the lymph actually flows to in the body. When you start to remove lymph nodes, you're removing filters and purifiers. So now the lymphatic system is starting to become more impaired because it's also part of the immune function. And fluid can start to build up, and that's what becomes lymphedema. But if the person has the surgery first and then it is followed up by radiation, from a long-term perspective, the remaining lymph nodes would start to become fibrotic, which means they start becoming like a scar, like scar tissue. And so the flow of lymph starts to be stagnant, more and more stagnant, because it's having a hard time flowing through those fibrotic nodes. So anybody that has lymph nodes removed and or radiated is at lifetime risk for lymphedema. And please be aware that your most common cancers, you've got melanoma, breast, prostate, lung, and colorectal. All of them can have lymph nodes removed for testing, like a biopsy, to make sure the cancer cells haven't spread. So just be aware that people can develop the swelling in that quadrant of the body, which could be lymphedema. Lymphedema actually takes a lot of treatment. So, from manual lymphatic drainage to compression bandaging to proper skin care and exercise. So it becomes a daily thing a person has to do with their life. So we don't want to be there to trigger it off at all. Anyway, I'm talking to you about some other free webinars that are available. And the reason I'm pushing these ones too is because I've done a lot of research with the Asian countries. Like you've got the Philippines and Japan and, gosh, I'm having a blank here. Anyway, a number of the Asian countries there, when they treat people for cancer there, they don't just use traditional treatment like your surgery, chemo, radiation. They can use surgery, radiation, but then they add traditional Chinese medicine, or they'll add herbal medicines, or they'll add acupuncture. And so they have a very big holistic approach to it. And I think that traditional Chinese medicine really has a place in our world. And so we've got Chantal Karen, and I think her name is Michelle Valerie, and they are offering these webinars. I know that the first one is East versus West, and that's the first one I'm really interested in. The others are very specific to pigmentation or acne and stuff like that. So typically these things are $99 each. If you can get them for free right now, go for it. Anyway, ladies, we have come to the end of our second webinar. I hope that this was informative to you. If you have any specific questions, please email us on info@oti-oncologytraining.com. And I hope you have a wonderful evening. So we'll see you tomorrow.